Hey guys, my name is Amanpreet Singh, and most people would say that going to the dentist is not on a list of things that they like doing. Whether it's the drilling noises or just the thought of people working on your teeth, I just don't know why more people don't like coming to me. So I can understand why hearing the news that you need a tooth taken out isn't so fun. But you know, sometimes things happen. Whether you have a cavity that's no longer fixable, or you're getting your wisdom teeth taken out, or you fell and you broke your tooth, or you're just gonna end up in dentures, there's plenty of reasons why you would need a tooth taken out. And if you've never had a tooth taken out before, it can be really scary. So I'm gonna give you some things to expect and to know before you get your first tooth taken out. Number one is how a tooth extraction is actually done. You don't just rip a tooth out with a set of pliers and rip it out of your jaw. And if that's what someone's doing to you, you probably wanna check that you're at your dentist and not actually at your local barber. Yes, back in the day, before dentistry was really a thing, your local barber would be the one to take out your teeth. And for a while, there was really no such thing as local anesthetic. And a lot of people actually died from these procedures afterwards because there were such bad infections and they were never treated properly. So look on the bright side, at least you need your tooth taken out now and not back then. A tooth is taken out by putting pressure between the roots of the tooth and the bone that surrounds it. Your roots of your tooth are attached to the bone by these ligaments called PDLs. These ligaments all have to be severed for that tooth to come out. Sounds painful, right? Well, luckily we have anesthetics and numbing we can give you beforehand so you won't feel anything during the procedure. But you will feel the pressure of the dentist pushing against that tooth. The dentist will probably use different instruments and try to insert them between the roots of your tooth and the bone. Slowly, that bone that surrounds your tooth will start to expand and your tooth will get more loose. When the tooth gets loose enough, the dentist will probably grab a different tool, like a set of forceps, and try to ease the tooth in different directions until it comes out. There's no ripping it out. And the dentist should be very careful during this part not to damage the bone or the surrounding teeth in that area. Now, obviously complications happen and everyone's teeth are different, so sometimes it can be more complicated, but that's generally the picture. So now you know how a tooth extraction is actually done. What else should you expect? Usually the dentist will make sure you're numb before they get started, and if you do feel anything during the procedure, they can give you a little bit more numbing so you stop feeling the pain. But you will feel the pressure of the dentist pushing against your tooth. Now, once in a while, your dentist will need to bring out a dental drill to help get that tooth out. Now, again, this is normal and sometimes it happens. If that tooth is being really stubborn, sometimes it's actually safer to split that tooth into 2 to 3 pieces, or even remove a little bit of bone that surrounds that tooth just to help ease it out. And if you are getting your tooth taken out, there's a good chance your mouth is gonna stay open for a while. If that sounds like it's gonna be a problem, you can ask for a bite block. A bite block is basically something that you bite on to help keep your mouth open. So if you're getting your tooth on your right side taken out, you would bite on it on your left side. And once that tooth is finally taken out, the dentist might need to put some stitches in there just to help it heal. And this will obviously vary depending on how complicated your extraction actually was. And sometimes these stitches will disappear on their own, and sometimes you'll have to come back for the dentist to cut them out. This will just vary depending on whatever stitches the dentist uses. And the dentist may also ask if you ever plan on getting an implant in the area to replace that tooth. Now, usually this is something that's planned out beforehand, because anytime you're getting a tooth taken out, you're probably thinking about how you're gonna replace that tooth. If you are gonna get an implant afterwards, there's probably gonna be an additional procedure with that extraction. And this is basically when you take that tooth out, there's gonna be a hole in your mouth. So instead of leaving that hole alone, the dentist will basically fill that hole with some bone grafting material. That way your bone doesn't disappear as much, and now you can help make sure that you have enough bone to get an eventual implant. And after you're done, the dentist is probably gonna go over some instructions with you afterwards. The biggest things are probably gonna be to avoid sucking through a straw, avoid spitting, and avoid smoking. These are what we call the 3 S's. And this is just gonna help make sure you don't get a dry socket after the extraction. A dry socket is basically when the blood clot that forms after you get your tooth taken out disappears, and this can be very painful. And the dentist may also give you some antibiotics afterwards, just depending on the case, but usually your mouth will heal just fine after a tooth extraction. You might need to take some pain medications for a few days afterwards, but I've seen people react perfectly fine and not have to take any medications. Just everyone's different. Thank you guys for watching. I hope you liked that video, and if you haven't already, hit that thumbs up button and subscribe to my channel below. I'll see you in the next video.